More and more women are stepping into specialized roles in the medical field. They are breaking barriers and bringing a new kind of care to patients. In the corridors of Belonomi Hospital in Bloemfontein, Dr. Riboni Tia stands out. She's a maxillofacial and oral surgeon, one of only 4 in the entire province and the only one serving in the public sector. It's a demanding and highly specialized field, but for her, it's also deeply personal.
Look, just getting into dentistry for me was, it's something that I decided on. It was a spur of the moment thing. But luckily when I got into dentistry, when I did my second year, that's when I realized that there is maxillofacial and oral surgery. Growing up, we didn't really, we don't know much about dentistry. We know medicine, and then we'll think about dentistry when we understand. So in second year, I decided right there and then that I will do maxillofacial surgery or oral pathology.
Dr. Tia is also one of only 2 women leading departments at Belonomi Hospital, a quiet reminder that change is happening even in spaces that have been slow to shift. She cautions that oral health is the least worrisome area for many patients, yet can be fatal.
I think the impact is very far-reaching. What we don't realize as the society or as the people is that dental issues or dental and oral diseases have far-reaching consequences. So me being here and knowing that I have made it a personal thing to teach my colleagues and mostly my patients that you do not sit at home because people do die from toothache.
Another medical trailblazer is Dr. Alicia Ferris, who specializes in pediatrics and is a super specialist in pediatric cardiology. Heading one of the busiest pediatric departments in the province, she says her unit happens to be where miracles happen.
We are actually running this at often up to a 60-bedded neonatal ICU. So what the work basically entails here, we are managing from premature babies. Those are babies born as early as 24, 25 weeks, up to full-term babies dealing with very complex situations, from cardiac defects to just basic neonatal jaundice. As a blue light there will indicate, that's a baby, for instance, with neonatal jaundice that's under phototherapy.
Dr. Ferris says she'd rather be working with babies and be their advocate. For her, being a double specialist in both pediatrics and cardiology is a blessing she shares with her patients.
Doing my undergrad and my postgrad in this very hospital, there was no such services. If you suspect a child has a possible cardiac condition, it's either you had to transfer the child to Universitas, and let's face it, even though Bloemfontein is situated or considered urban and not rural, a lot of the challenges we face are still rural. For instance, EMS and everything. So having this service at this hospital, in particular this unit, has made such a difference.
Enters Sabata, a midwife and reproductive health specialist offering services through her private clinic, Black Women Arise, which is based in Bloemfontein. She says her own struggle with reproductive health lit a fire in her to be the support she never had. Through her Black Women Arise Women's Health Foundation, she's also a big partner of the Provincial Department of Health. She has sponsored a clinic based at the Botshabelo Hospital where women who have abnormal pap smear results are able to get the next level of care on time.
Okay, so I'm the founder and CEO of Black Women Arise Women's Health Foundation and Black Women Arise Women's Health Clinic. So the foundation is focused on promoting access to quality sexual reproductive health services for women in disadvantaged communities. So we make use of a mobile clinic. We go into these hard-to-reach areas to provide different sexual reproductive health services like cervical cancer screening and so on. And then the reproductive clinic is just basically providing child and maternal health care services for, I would say, middle income women that are able to pay a little bit of money to make sure that they get access to quality healthcare services.
Sawan, mostly proud of the impact her foundation is making, acknowledges that her work has impacted the intended communities.
Most times it's just unbelievable because, like I said, it just started off as a seed as me wanting to have an impact in my immediate community, with women that I had interacted with that said, they suffered from similar problems, and then also being a healthcare professional, seeing that many women are unable to come into healthcare facilities because of a lack of information. So I just really went really hard at ensuring that I'm able to make a little bit of a difference. But now looking back, it's just really been so impactful. We've been able to quite literally save a number of women's lives.
All three have one thing in common, their passion to save lives. Kamagelo Siekwi, SABC News, Bloemfontein.